Welcome, everybody. My name is Marty Mascari. I'm with the North Central Texas Area Agency on Aging and the North Central Texas Aging and Disability Resource Center, or ADRC. Both the Area Agency on Aging and the Aging and Disability Resource Center are under the umbrella of the North Central Texas Council of Governments in the greater Dallas-Fort Worth, Texas area. We're blessed again here to have, number one, my cohorts with the Area Agency on Aging, Melinda Gardner and Felicia Warner, but we're also blessed to have our partners at the Better Business Bureau Education Foundation in Houston. Veronica is here to join us as well. But before we get started, I want to first talk about the CEUs for those of you that are on looking for CEUs. We are offering both CEUs for licensed social workers and licensed professional counselors in the state of Texas. We are also offering certificates of attendance if any of you are interested in getting one of those. Just know that anybody is welcome to go through the process to get to CEUs, but understand that these are the only jurisdictions we're set up with. I have heard secondhand that there's other jurisdictions that accept them, whether that's inside of Texas or outside of Texas. But please note there's no guarantee of that. In order to get the certificates, you need to, first I should say today's webinar is worth 1.5 hours of CEU credits. In order to get either of the certificates, either a certificate of attendance or a CEU certificate, you must have completed the entire live webinar or the live recording that will be next Monday. We usually do that in the afternoon, the same day, but this month we're doing this in the morning and next Monday in the afternoon. You must complete once you're all done with the webinar, you must complete the Google evaluation survey form. That form should pop up for you as you pop out of Zoom today. If it doesn't, you will receive a follow-up email with that link. And please note that follow-up email will not go out until Thursday. So I've given you all until 2 weeks to finish that, as opposed to the week that I usually give you. I'll be back. It's hard for me to do that. I'm traveling, and I will do that when I get back in the office on Thursday, send out that follow-up email. So if it doesn't pop up as you get out of Zoom today, please look for that follow-up email on Thursday. Again, the evaluation link will be good for 2 weeks from today. And then give me 3 weeks after that to get them out. And I have not sent out the ones for last month yet. I had some personal health issues over the last month, and I'm a one-man operation, so I am behind. And I will get caught up, but I have not sent out the CEU certificates or the certificate of attendance for our last month's Medicare Mondays. So I'm going to turn it over to Melinda Gardner, and you can take it from here, Melinda.
All right, thank you very much, Marty. And today we have Felicia Warner, who is with the North Central Texas Area Agency on Aging, and she's going to tell a little bit more about herself and about one of our topics for today. Felicia, if you want to go ahead and begin.
Yes, thank you so much, Melinda. Thank you, Marty. My name is Felicia Warner. We are the Area Agency on Aging of North Central Texas, a program of North Central Texas Council of Governments. We are also known as SHIP, which I'll explain about that shortly. We also partner with the Texas Senior Medicare Patrol to provide information on fraud and abuse, and we are co-presenting again with Veronica today, who will share information. State health insurance assistance programs, which SHIPs are federally funded. The SHIP program was established by Congress, and their work is funded by the U.S. Administration for Community Living at the U.S. Department of Health and Human Services. There are 54 SHIP grantees, one in all 50 states, including Puerto Rico, Guam, which I want to go to, District of Columbia, and the Virgin Islands. SHIP services are delivered by state units on aging or state departments of insurance and health partnerships with local area agencies on aging and other community-based partners. Nationally, SHIP oversees a network of more than 2,000 local sites, over 12,000 team members, including staff, professionals, and volunteers. In addition to SHIP services, many provide information from the Senior Medicare Patrol, which help Medicare beneficiaries protect, detect, and report healthcare fraud, abuse, and errors. And SHIP also recruits and trains volunteers. SHIP team members are highly trained and certified to assist people in obtaining coverage through original Medicare, Parts A and B, Medicare Advantage, prescription drug plan, and Medigap, which is the Medicare supplement. We also at SHIP and at the Area Agency on Aging assist beneficiaries with those with limited income to apply for programs such as Medicaid, the Medicare Savings Program, Extra Help, and the Low Income Subsidy. And this will help pay or reduce their healthcare costs. And we do this by providing information such as today, distributing information, conducting enrollment events, and participating in health fairs, senior fairs, and other community events. So we'll go to the next slide. The Administration for Community Living manages the State Health Insurance Assistance Program, or SHIP. And we provide, and I always like to say this, unbiased information to our beneficiaries, our clients, and their families and caregivers. Working with state offices, local agencies, and community providers, SHIP establishes community-based network of counselors who help in person or by phone, make group presentations, and use a variety of media sources to educate people about Medicare. And I also want to add, SHIP helps our beneficiaries understand the costs and coverages and comparing options and completing the enrollment process into Medicare. The SHIP TA Center serves as a central source for our information, expertise, and technical assistance. So, and again, roughly 40% of our contacts occur during open enrollment. So we anticipate that capacity. So if you're wanting to reach out to us, please do so now, and you can learn about what services we offer. And now my favorite part is the video of volunteer opportunities, in which I was a volunteer.
Many people find Medicare confusing. Make it easier and make a difference. Volunteer with your local SHIP and help people in your community navigate Medicare. You can volunteer virtually or in person, one-on-one or in groups. There's a wide variety of volunteer roles. You don't need a background in health insurance to get involved. SHIP provides the training.
I don't get paid for this. I'm a volunteer, and I get more out of doing this than what I did on a paycheck.
It's just a joy, a blessing to help and to give. And it doesn't take very much of your time.
If you go through the training, you give it a chance, you'll see the value not only for yourself, but you also see the value in others who you're able to assist.
As a SHIP volunteer, you can give back to your community, stay connected, and build your skills. Contact the SHIP office in your area to learn more. Depending on your area, the SHIP program may also be known by one of these names. Many people find
Okay, we're going to talk about preventative services this morning. And what is disease prevention and why is it important? Which preventative services Medicare covers and how often, and who can get these services, and what you pay. And again, most often you pay nothing for many services. Preventative services that include screenings, checkups, and patient counseling to prevent illnesses, disease, and other health problems also detect illness at an early stage when treatment is likely to work best for an individual. But really, the goal is to ultimately prevent disease, disability, and death. So Medicare preventive services also, they cover many services about to promote your health and well-being, and that, you may find health problems early and they're most likely to be treated, and that'll work best for you. Okay. And we're all concerned about cost. I know I am. I'm personally concerned about cost. Preventative care is the care you receive to prevent illness, detect medical conditions, and keep you healthy. If you meet the eligibility requirements and guidelines for preventative services, then Part B of Original Medicare or Medicare Advantage plan must cover that service. Under Original Medicare, you owe nothing, no deductible or co-insurance for preventative services that are recommended by the U.S. Preventive Services Task Force. If you see a healthcare provider who takes assignment, very important, the provider must take assignment. If you have a Medicare Advantage plan, you owe nothing for those services as long as you see a doctor in your network. If you have questions or want to find out more about preventative services, you can contact our office to learn more. So we'll go and see the list of preventative services, and we can see that that list is pretty extensive. And due to time constraints with the webinar, we're not going to go through each one of those. We're going to discuss the Welcome to Medicare preventative visit, the yearly wellness visit, and a few others on this list. So what is the Welcome to Medicare preventative visit? The Welcome to Medicare preventative visit is a one-time appointment you can choose to receive when you are new to Medicare. The aim of the visit is to promote general health and prevent diseases. Medicare Part B covers your one-time Welcome to Medicare preventative visit, and you must receive this visit within the first 12 months of your Part B enrollment. The Welcome to Medicare preventative visit is not a head-to-toe physical. At this visit, your weight and height will be checked, and I dread having my weight checked, but really also review your medical history, which is so important. And because your medical history includes your family history, that a doctor can use this to identify diseases or health problems that run in your family. This allows the doctor to assess your risk for certain diseases or conditions. It can serve to help prevent the onset of certain diseases or health problems. So what is an annual wellness visit? The annual wellness visit is a yearly appointment with your primary care provider, your PCP, to create or update a personalized prevention plan. This may also help prevent illnesses based on your current health and risk factors. Keep in mind, the annual wellness visit, again, is not a head-to-toe physical. Also, this service is similar to, but separate from the one-time Welcome to Medicare preventative visit. Medicare Part B covers the annual wellness visit if you have had Part B, Medicare Part B, for over 12 months and you have not received your annual wellness visit in the past 12 months. Additionally, you cannot receive your annual wellness visit within the same year as your Welcome to Medicare preventative visit. So let's talk about how the preventative care is different from the diagnostic care for a minute, just a minute. A service is considered preventative if you have no prior symptoms of the disease. For example, at colonoscopy, would be considered preventative care for an individual who has no prior signs of colon cancer or suspected polyps. In some cases, Medicare only covers preventative services if you have certain risk factors. And that's how important it is to go over your health history and your family history. In contrast, diagnostic services address symptoms or conditions that you already have. Many preventative services are provided alongside care that is diagnostic or alongside other healthcare services. The classification for services as preventative versus diagnostic is important because it affects your out-of-pocket costs. You typically owe a copay, coinsurance, and/or deductible for diagnostic services. For the annual wellness visit, which is Medicare covered preventative services, no cost sharing applies. However, if your provider investigates or treats a symptom you are experiencing during your annual wellness visit, this additional care is not part of the annual wellness visit, and cost sharing, like coinsurance or copay, may apply. Medicare covers other preventative screenings for several kinds of cancer at 100% of the Medicare approved amount, meaning that if you meet the eligibility requirements, you don't have to pay for anything, no deductible, no coinsurance. If you receive the diagnostic screening, or if during a screening your provider discovers and treats a new or existing problem, charges most likely will occur with that visit. And we'll just go over some, again, of some of the preventative services, which is many. It's extensive. It's an extensive list, but to stay on time with this webinar, we just can't cover them all. Cervical and vaginal cancer screenings. Pap smears can detect cervical or vaginal cancer in its early stages. They can also screen for sexually transmitted diseases, fibroids, and various other genital and vaginal problems, including cancer. The pelvic exam at that time will also include a breast examination, which can detect signs of breast cancer. Medicare covers these services every 24 months. You may be eligible for these screenings every 12 months if you are at a high risk for cervical or vaginal cancer, or if you are of childbearing age and have had an abnormal pap smear in the last 36 months. And then again, the cervical and vaginal cancer screenings for all women once every 24 months or every 12 months, but Part B covers the HPV test, and you can get that every 5 years. If you are 30 years old to 65 without any symptoms, and no cost to your provider. No cost to you, I'm sorry. Mammograms, very important. Mammograms, even if you do not have any symptoms or prior history of breast cancer, Medicare Part B covers preventative mammograms. One baseline mammogram for women 35 to 39 years old, and one screening mammogram every 12 months for women over 40 years of age. Medicare does not cover preventative mammograms for men, hopefully maybe one day soon. Medicare does cover diagnostic mammograms for everyone. Your doctor might recommend a diagnostic mammogram if your screening shows something abnormal or if a physical exam reveals a lump. Medicare covers as many diagnostic mammograms as necessary, but they're covered at 80% of the Medicare approved amount, while preventative mammograms are covered at 100% of the Medicare approved amount. Prostate cancer screenings. Medicare Part B covers one annual prostate cancer screening for individuals age 50 and up. The prostate screening includes a digital rectal exam and the very important PSA test. And colorectal cancer screenings. Medicare Part B covers different colorectal cancer screenings, each with separate eligibility requirements. Also, you may be at high risk for colorectal cancer if you have a family history of the disease and have a colorectal cancer or polyps, or if you've had inflammatory bowel disease. And here are various colorectal cancer covered screenings, and you see the screening test. If it's normal risk, covered once every 12 months or so, or 4 years, you can just read from the slide. If it's high risk, it's covered every 12 months and every 4 years, and it shows what you pay. If you pay nothing, if the provider accepts assignment. And it's continued again if you have a normal risk or high risk, and then what you pay with the screening. Lung cancer screenings. Lung cancer screenings, Medicare Part B covers a yearly lung cancer screening and a yearly low dose, it's called a low dose CT scan, CT chest scan for people with certain risk factors. Before your first CT chest scan, you must have had visited your primary provider, your PCP, to discuss the benefits and risks of the scan. Your PCP will provide counseling on the importance of quitting smoking, just stop smoking, avoid smoking, and information about smoking cessation. Services when appropriate. So in a nutshell, you know, of course, your doctor always says stop smoking. And this is one way to get tested with lung cancer screening. After your first scan, a separate counseling visit is not required before you receive your annual CT chest scan. Medicare Part B will only cover these services if you are age 55 to 77, you currently smoke or you have quit smoking in the past 15 years, have smoked on an average of 1 pack a day for at least 30 years, you have no symptoms of lung cancer, and receive the screening at a Medicare approved radiology facility. Depression screening. Depression is a mental health condition that affects mood. Depression screenings should be conducted by your primary care provider, your PCP, or another trusted health professional to ensure that you are correctly diagnosed and treated. Medicare Part B covers an annual depression screening, and you do not need to show signs or symptoms of depression to qualify for the screening. However, the screening must take place in your primary care provider's office, like a doctor's office. This means Medicare will not cover your screening if it takes place in an emergency room or a skilled nursing facility or hospital. We'll go on to the next slide. Flu shots, we know how important those are. A flu shot is medically, and Medicare generally covers the flu shot once every flu season, because there's always a new one. All people with Medicare are eligible. It's at no cost if a provider accepts assignment. The pneumonia shot, the hepatitis B shot, and the COVID-19 vaccine. Abdominal aortic aneurysm screening. And who's covered with this? Medicare covers a one-time abdominal and aortic aneurysm ultrasound for people, again, at risk. You are considered at risk if you have a family history of aneurysm and abdominal and aortic aneurysm, or you are a man 65 to 75 and have smoked at least 100 cigarettes in your lifetime. Medicare covers this screening once in your lifetime if you get a referral from your doctor. You pay nothing for this screening if the doctor or other qualified health provider accepts assignment. So that accepting assignment is really the big part of getting your preventative screenings. So we'll go to the next slide. Alcohol misuse screening and counseling. Alcohol screening and counseling, and who's covered with this? Adults with Medicare, including pregnant women who use alcohol but don't meet the medical criteria for alcohol dependency. How often is it covered? Medicare covers one alcohol misuse screening per year. If your primary care doctor or other primary care practitioner determines that you are misusing alcohol, you can get up to 4 brief one-on-one counseling sessions per year. A qualified primary care doctor or other primary care practitioner must provide the counseling in the doctor's office. Again, you pay nothing if your primary doctor or other practitioner accepts assignment. Bone mass measurements. Medicare covers the bone mass measurements to see if you are at risk for broken bones due to osteoporosis. Osteoporosis is a disease which your bones become weakened and brittle. In general, the lower your bone density, the higher your risk for fracture. The bone mass measurements results will help you and your doctor choose the best way to keep your bones strong. Cardiovascular disease behavior therapy. Who's covered under this? All people with Medicare are covered once a year. Again, you pay nothing if your doctor or qualified care provider accepts assignment. The cardiovascular disease screening, Medicare covers this, and this will check for your cholesterol and other blood fat levels. High levels of cholesterol can increase your risk of heart disease and stroke. These screenings will tell if you have high cholesterol, and who's covered? All people with Medicare. If the doctor orders a screening, the doctor can order screening every 5 years. Diabetes screening and self-management training. Diabetes is a medical condition in which your body doesn't make enough insulin or has reduced response to insulin. Diabetes causes your blood sugar to be too high because your body needs insulin to use sugar properly. And that's been the hardest thing for me to learn. A high blood sugar level is not good for your health. Medicare covers blood screening to check for diabetes for people at risk. For people with diabetes, Medicare covers additional educational training to help manage their diabetes. Glaucoma test. Glaucoma is an eye disease caused by high pressure in the eye. It can develop gradually and without warning and often without symptoms. The best way for people at high risk for glaucoma is to protect themselves, is to have regular eye exams. And people who's covered, again, people with Medicare who are at a high risk for glaucoma, and it is covered once every 12 months. Hepatitis B shot. Medicare covers hepatitis B vaccination if you are at a medium or high risk of hepatitis B. If you are at a low risk of hepatitis B, the shot will be covered under Medicare Part D, the prescription drug benefit. At COVID-19 vaccinations, original Medicare Part B covers the COVID-19 vaccine regardless of whether you have original Medicare or Medicare Advantage plan. The Food and Drug Administration has approved an additional dose of COVID-19 vaccine or booster for people aged 12 and older. The additional dose or booster is covered by Medicare with zero costs. Of course, always speak with your doctor to learn more about getting any vaccines or getting a third dose or booster. Medicare covers COVID-19 tests. Medicare will cover one coronavirus test without an order from a doctor or other qualified healthcare provider. For other tests, Medicare requires that you get an order from your provider. And then again, if the doctor takes assignment, that means you owe nothing. And Medicare Advantage plans are required to cover coronavirus testing without applying deductibles, co-payments, or coinsurance when you see an in-network provider. Smoking and tobacco cessation counseling. The U.S. Surgeon General has stated that quitting smoking and stopping other forms of tobacco use leads to a significant risk reduction for certain diseases and other health benefits, even in older adults who have smoked for many years. Any individual who uses tobacco can get counseling from a qualified doctor or any other Medicare recognized provider who can help them stop using tobacco. You pay nothing for this counseling services for when you are trying to stop using tobacco. And that's pretty much all I have. It's been a pleasure to present and share information with you. Again, I'm Felicia Warner. If you have any questions, please place them in the chat. And I'll turn this over to Melinda to introduce our next presenter.
Thank you very much, Felicia, for providing us that important information. There's always questions about the preventive services and how they work. And it's a good thing that you went over the fact that everyone's not eligible for everything.
Yes.
And so it helps to know what someone's eligible for, and especially speaking with their primary care physician.
Very important.
Yes. All right. Now we'll go into our presentation with Veronica. And I believe, Veronica, that I am giving you access to change the slides if you want to double check to make sure you have that access.
Okay. Let me see.
Yeah. Okay.
Okay, yeah, I do.
Okay, let me turn off my video. All right, it's all yours.
Well, good morning, everyone. I'm pleased to be here on this Monday morning trying to recover from our weekend. And we here are the Better Business Bureau Education Foundation, part of the Senior Medicare Patrol. And we are a federally funded program, and we have one in every state. And our job is to recruit, train volunteers and professionals about Medicare fraud and abuse. We also assist people in reporting intentional fraud and abuse to Medicare fraud control units. Okay, so here we go. Today's topic is regarding fake government imposters. What do they want? Why do they want my information? What are the tricks, tactics, and here's the truth of what they're all up to. So let's go back. What do they want? Let's make it simple. They want your money, and they want it in a way that is untraceable. And way to be untraceable is cold cash, gift cards, cryptocurrency, wire transfers, and prepaid debit cards. These forms of payment are usually untraceable and almost impossible to recoup. So once you put your money in these forms of cash payment, chances are, if it's a fraud or a scam, you're not going to be able to recover that money because it's untraceable. And the main thing that these scammers are after is your social security number, bank accounts, Medicare. In the past, Medicare social security numbers were used in almost every aspect of our lives. This is the way we were registered. Once we were born, we were registered. We got our social security numbers. It was used to obtain services, state services, to register for driver's license, you name it, that social security number was used. And as a result of that, it was so easy to have scammers steal your social security numbers and use it to obtain services, loans, etc., and under your name. Same thing goes with bank accounts and Medicare numbers. Did you know that social security scams are the most common form of government imposter scams? People are getting calls on the daily from certain scammers indicating that they're from Social Security. As per AARP, the Office of the Inspector General has received over 718,000 complaints about scams in the past year or so, beginning in September of 2020. There is about 50% increase from the same period the year before, and it just keeps getting worse every year. So again, what do they want? What are their tricks? To name a few, we will go over some right now. So your social security number is the key to identity theft. With that number, they can do many, many things underhandedly without you even knowing. Examples of identity theft would be a stolen Medicare number, where people can file false claims, obtain supplies, DME supplies such as walkers, diabetic equipment, things that you did not order. There will be error, fraud, and abuse on your Medicare summary notice. That's why we encourage everyone who has a loved one or is on Medicare themselves to review those summary notices, because if there is any sort of error, fraud, or abuse going on, it's going to show up on your Medicare summary notices. And it's up to you and to us to review those notices religiously, just to make sure that whatever is being billed to Medicare are actual services that one is receiving. The second form of identity theft is usually we have adult children using their elderly parents' benefits. You know, they try to access their food stamps, prescription drugs, their Medicare numbers and Medicaid to use them for themselves. Some adult children might not have some sort of health care, and they will go out and use their parents' health care insurance to obtain services that they might be needing at the time. Stolen social security numbers are usually used for filing for unemployment benefits, to take out loans and credit, or to file taxes. The Social Security identity theft is the one that is the most damaging because it takes the longest to repair, and the repercussions of having your identity stolen are just overwhelming. I have a family member that went through that and is still trying to fix that, and it's been years. Every year, this individual has to go to the IRS to prove they are who they are before they file their taxes, because when and if they do file their taxes, someone else in another state is using their Social Security number to, I guess, they're working somewhere, so their wages are appearing on their Social Security number here. So when tax time rolls around, the IRS is flagging their Social Security number saying, wait a minute, you're working up in Washington State. How come you're not reporting those wages? So there's a big problem. They have to go back to Social Security and review all their work history to make sure that they are who they are and that the services, the wages that are being reported are theirs actually. So yeah, it's a big mess. Another form of identity that would be your bank account numbers. That is your money. Once you put that bank account number out there, it's almost more than sure that someone's going to try to take your money from that. That's the only reason why they want your bank account numbers. And we suggest, instead of your banking information, try using a credit card for purchases rather than a debit card. And the reason for this is that credit cards offer far more protection than do banks. So once you use a credit card, and if there is fraud reported, then it would be easier for you to dispute those fraudulent charges than if you were linked to a bank. Why do scammers target Medicare beneficiaries? Because Medicare cards are worth about $30,000 to a scammer, not to you. Usually what they do is they'll call and they'll claim to be from Medicare. And one of the most popular scams right now is someone calling a Medicare beneficiary to let them know that Medicare is offering a new Medicare card made of plastic with a chip. And in order to access that card, you have to pay a fee of about $299. And they ask for you to provide them with your Medicare number so that they can verify, make sure that they have the correct information so they can send you your card. That is a lie. Of course, it's a fraud. We suggest that you hang up or just basically do not answer your phone. Medicare will never call you. Social Security is never going to call you. IRS is never going to call you. So the reason it's so easy for a scammer to get away with $30,000 off your Medicare number so quickly is because Medicare processes about 5.4 million claims per day. So they have a window of about 30 days to process these claims. So a lot of documentation is not required from people submitting these claims unless they're being investigated. So only 3% of the claims are reviewed. So this is why we at Senior Medicare Patrol are out here providing this information to let people know that it is very important to review your summary notices, because this is where you're going to capture all that fraud and erroneous billing. And go to the next one. So how these scams work is that you'll receive a phone call, an email, or a text message from a scammer pretending to be an agent from either a Social Security office, law enforcement, or some other type of government agency. And they're usually robocalls. And these robocalls are pre-recorded messages that are submitted through auto dialing technology. So you'll get these random phone calls on the daily, and your phone never stops ringing. And when you pick up, if you pick up, you'll hear a pre-recorded message. So right there and then, red flag, just hang up. Types of robocalls are people soliciting you for health insurance information for COVID-19, or they're offering you supplies for COVID-19, sweepstakes, Medicare plans, Social Security car warranty. That's the one that's really out there right now, are the car warranties. We get phone calls on the daily regarding these so-called car warranties, surveys, computer updates. IRS scam overview. And I'm going to play a little video. It's just a few seconds long.
Scam artists are pretending to be IRS officials to get your money. They'll call, email, or text you, claiming you owe back taxes or there's a problem with your tax return. They even rig caller ID to make the call look official. They play on your fears. They threaten to take your driver's license or sue, arrest, or deport you. They want you to pay fast. What's the truth? The truth is the IRS's first contact with you will always be a letter in the mail. It's not a phone call, email, or text message. They won't insist that you pay with a prepaid debit card, a wire transfer, or cashier's check. Now you know. Has an IRS imposter contacted you? Report it at ftc.gov/imposters.
So there you have it. IRS will never call you.
Scam artists are
and neither will Social Security. Now, the call with Social Security usually entails them telling you that we have a problem with your Social Security number. That right there will alarm you automatically, and you set you into panic mode. Social Security numbers, that's your lifeline, of course, and scammers can make the caller the caller ID on your phone seem like a number that is local. You know, they disguise your number, or the caller ID will say Social Security Administration or Health and Human Services. So that tempts you to want to answer that phone call. But just keep in mind that unless you called Social Security and asked them to give you a call back regarding a certain issue with your benefits, they will not call you. The same goes for Health and Human Services. If you are applying for any program through the state of Texas, Health and Human Services Department, then yes, you have an application out there. They might want to speak to you regarding certain items in your application. Then yes, you might want to answer that call. But if you haven't applied for anything and you haven't contacted Social Security for whatever reason to have them call you back, do not answer that call. Phishing is yet another form of scamming that is going on right now. And it's just like the word says, phishing, but except with the P and the H. And it's basically what it is phishing. They throw out an email or some sort of text, hoping that someone's going to bite and click on it, and that would give them access to your computer, your phone, with something malicious called malware. So basically what you do, and we suggest you do, is ignore calls from unfamiliar numbers. Don't click on anything suspicious, any text messages. Verify that you know the recipient and delete it. So criminals have three primary ways to steal information. They have something called malicious web links, malicious attachments, and fraudulent data entry forms. So once you click on these items that they sent you, they quickly gain access to all your information, including banking information, your personal information. Very, very dangerous. So threats are that they use typically are, oh, you will be arrested if you don't pay the $5,000 you owe the IRS. You will spend time in jail. You will pay legal fees in court, unable to access your benefits. Cancel your benefits. That's another one. Cancel your Social Security checks. These are all threats that are used by scammers to persuade you to pay or click on a link to try to get these issues fixed. And usually they'll ask you to pay some sort of fee in the form of a gift card. And that right there, the minute they mention gift cards, that is typically a red flag. Or they'll also tell you that they're going to be revoking whatever benefits you're receiving. Medicare will suspend your Medicare benefits. They're offering a solution to increase your benefits, protect your assets, or resolve the matter of identity theft. So sometimes you'll have these people calling you and say, hey, we can increase your Social Security benefits. All we need is your Medicare number so we can see if you qualify and we can get you that money as quick as possible, type of thing. And people fall for this. So the Inspector General has provided reassurance that Social Security will never call you. 1, demand immediate payment or fine fees or ways to avoid legal action or jail time. This is something that is very popular with these scammers. They're demanding that you pay a certain fee, or they will come in. I got a call like this not too long ago saying, oh, you owe us $3,000. We have issued a warrant for your arrest. If you don't pay right now with a prepaid card, we know where you work. We're going to go get you. So basically I told them, well, come and get me. If you show up here, I'll pay you, type of thing. Of course, they never showed up. And of course, they will ask for you to pay with gift cards and things like that. So another type of threat they say is if you don't pay, your Social Security number will be suspended and revoked, or you won't be able to use that number anymore. If you don't wire or send gift cards to anyone you don't know, don't return calls. Instead, call the Social Security main number, which is this one, the 1-800-772-1213. Just keep in mind, your Social Security number is yours forever, unless you enter some sort of that protection. What is it? The government puts you in protective custody and they have to change your numbers because they're kind of hiding your identity, type of thing. But never, ever will you lose or someone take away your number. Again, Medicare will not call you. Then never provide your personal Medicare information to anyone over the phone. Keep an eye on your MSNs and report any suspicious behavior to us at Texas Senior Medicare Patrol. And this is our number, 888-341-6187. 888-341-6187. I guarantee you will speak to a live person and not a recording. In the news, a mother to be lost $5,000 to a government imposter scam that they were claiming to have a warrant for her arrest. And you can probably read up on this. I'm not going to go too much into it, but what did happen was that they scared her enough to pay this in the form of a prepaid debit card. I mean, she's pregnant, obviously needs money for her baby, her newborn, and they were able to take it. Money transfer apps. Everybody loves Cash App, Zelle, very convenient forms of ways to send money out, to purchase items or to loved ones. These type of cards are usually connected to your bank accounts. And once you send the money, it's gone. So these type of money apps are not protective forms of ways to send money. So once the money is gone, and if it is a scam or a fraud, you will never get that money back. And with the way these frauds or these scams work is that you'll get a call from someone say, oops, I think I sent you $100 by mistake. Can you send them back to me? Type of thing. or people sending Zelle money to purchase items online, like on Facebook. That's very dangerous, because what's happening is that these vendors are indicating that they're having issues sending the money. So they'll ask you to send money first, and then they're promising to send it back to you once they receive it. A lot of people do fall for this type of scam. They send their money out and never get it back. Be very, very careful with these type of purchases, especially off of Facebook, because those are not protective websites. And many times, a lot of the vendors on there are just out there to scam you. I know my brother-in-law got scammed a few months ago with a purchase he made on Facebook. Safety tips. Instead of attaching your bank information to any of these forms of payment, we're suggesting you use a credit card. As we said before, credit cards offer far more protection than would your debit card. Verify recipients before making a transfer. Don't just send to anyone that you're not familiar with. Have extremely strong passwords. Keep all your transactions private, and check your bank accounts. Right after you send that money, make sure that only that amount of money got taken out and not all of your money. Back in 2022, we had these going on with the voter polls and registrations and political donations. They were offering fake prizes or offering you the opportunity to vote by phone. And the reason they were doing that, because in order for them to allow you to vote by phone, you would have to provide them with your personal information. And this was a surefire way of them obtaining that information from you. So recommendations, of course, are never give personal information or money to anyone that calls you randomly over the phone. If someone is trying to contact you regarding these type of issues, you contact your local election official at this canivote.org, and also research any funding organization. Don't just give money to anyone. You need to make sure that the organization is for real and they are actually collecting money for what they say they are collecting money for. Always report it. It's very important not to turn a blind eye to these type of scams that are going on. It's very important for everyone to report these, because the more complaints that we get, the easier it is to build a case against a certain individual that's scamming people out there. So this is our phone numbers. You can report your Medicare fraud to our hotline, like I mentioned before, at 1-888-341-6187. And these are the people that are in our Houston office. This is Jennifer Salazar. She is our director. We have Diane Nguyen, and she is our assistant director. And we have Lily Shu as our project coordinator. I want to thank everyone for your time and hope everybody has a wonderful week. Thank you.
Nice. As you guys are looking to see about questions and that kind of thing, could we go to the next slide and I'll talk about I know we had, Melinda had to unshare and reshare, but we'll talk about the CEUs one more time and next month. And then if you guys could check for any questions, that would be great while we're doing that. There we go. For those of you that are joining us for CEUs today or to get a certificate of attendance, these are our guidelines for doing both. First of all, we are set up for CEUs in Texas for licensed social workers and licensed professional counselors. If you have a different license in Texas or a license outside of Texas, you are more than welcome to go through the process, get a certificate, and submit it to your jurisdiction, just so you know there's just no guarantee that they will accept that. We're going by the guidelines for the two in Texas. You can also get a certificate of attendance. Those are available. The rules and guidelines for each of these are the same. For attending today's webinar, it's worth 1.5 classroom hours of credit. You must complete the entire webinar today or the entire live recorded webinar with Q&A next Monday afternoon. You must also complete the Google survey evaluation. It should give you the option to go to that as you close out of Zoom today. If you don't get that for some reason, and I realize some companies and that type of thing have pop-up blockers, you will also receive that in a follow-up email, but I want to once again make the note that follow-up email will not go out until Thursday. I'm traveling and I won't be back in my office till Thursday. That will go out on Thursday. Because I'm in my office, I'm not in the office. I'm going to give you 2 weeks from today to complete that survey. We usually give you 1 week, but I'm going to give you 2 weeks from today at 5 p.m. That survey will be available to y'all, and then please give me about 3 weeks after that to get the CUs out. And once again, I am sorry, I do not have the CUs out for the February 13th Medicare Monday. So those have not gone out yet. But any of the Medicare Mondays prior to that, if you have not received your certificate and you think you were to get one, you need to send me an email and let me know the topic, the title of the webinar, and what the date of that was. I don't have a way to go through and check every webinar for everyone and see who did, if you attended or not. You're going to have to give me the specific date and title for me to look at that, and I'll be happy to do that. So that's that for CEUs and for certificates of attendance. Could we go to the last slide real quick? I want to tell you all next month, we're going to be on April 10th, and we'll be talking about complaints, grievances, and beneficiary resources, and speaking with your doctor. And that will be on April 10th. And I'm going to turn it back over to Melinda, and you guys can answer questions or whatever you like.
All right. And just a reminder that the afternoon session that we normally do today will be next Monday, March 20th at 3 p.m. instead of today at 3 p.m. So feel free to share the word that we will be doing that afternoon session next week. Thank you, Marty, and thank you to our presenters today. And there were some questions in the chat. Felicia, were you able to pull those up?
It was just one, but
Okay.
it was about just a lady, Miss Foster, just says she's recommending, I believe, preventative services to every senior that she knows. And then I believe the next question is more of a Veronica question, and someone has getting calls. Veronica, do you see that question?
Yes. I learned recently, if someone has an iPhone, there is a way to go into the settings and block unknown callers. If the person is not registered on your contacts list, the phone will not ring. It'll go straight to voicemail. So if it's a scammer, more than likely, they're not going to leave a voicemail. But if it's a legit call, they usually will leave a voicemail, and you're able to access that voicemail and call them back if it's important. But I wouldn't be able to tell you how to do the settings thing for the iPhone. But I know that my older relative did that. And she tells me now that her phone hardly rings, hardly, just some people that she has on her contact list. But if it's not on your contact list, it will not ring at all. So you might want to go to your local phone provider and see one of the techs there might be able to help you set that up. And that would save you a lot of worry and, having to deal with those unwanted calls.
Yes, that's a good suggestion. Check with your phone provider. And if he is continually getting switched to these plans, also you may be able to contact Medicare to have him switched back to what he had. so that hopefully he can still see his doctors. But if you do have some issues with that, feel free to reach out to us if you need further assistance. There were a few questions in the chat, so let me.
While you're doing that, I'm going to respond to Marcella. Just so you know, if you guys are participating in these and you filled out the survey, for everything prior to February, I have already sent all those certificates out. The reason why someone may not have gotten a certificate could be 3 different reasons, I guess. The first one would be if they didn't fill out the survey. They wouldn't. That's what triggers the certificate, is you would have to have completed the Google survey on time. The second reason would be if our Zoom report doesn't show that you attended the entire webinar, and if it doesn't show that, then it's going to kick it out and not send you a certificate. The third way is if you're not attending the webinars under your own name. If you've gotten the link from a friend or your group together in someone's office watching this together, it's not going to show your name on the Zoom report. So then I have no documentation that you would have attended. So you need, once again, you need to send me the name and the date of the ones you're asking about, and I'll be happy to go back and check on those. And I can either, there's been a few times where there's been glitches, but most of the time it's one of those 3 issues. But I will happy to check on that for you and respond.
Thank you, Marty. All right, there was a question. The Advantage plans do make phone calls though, right? Yes, they do. And Judith answered that, almost what I would have said. Advantage plans can only call if the person has a plan with that company. So they can't cold call you, but if you do have a plan with them, then they do have a right to call you in reference to that particular product. They cannot talk to you about other products during that call, but they can talk to you about the Advantage plan. But if you fill out a card or send something back to them that you want to take advantage of all of your benefits, then that opens up the door for them to call you about other products that they may sell. So keep that in mind for you or your loved ones when you're filling out those postcards or sending information back that comes in the mail. I get those like in the middle of a magazine. You have those postcards. For more information, fill this out and send this back to us. Well, when you send that back to them, that's opening that door for them to call you and provide you with information or try to sell you something. The Senior Medicare Patrol phone number, Veronica, if you would put that in the chat, that would be great. Somebody's asking for that number again. Marty, did you answer the question about certificate of attendance? Or just the certificate? Okay.
I did not see
if
that.
we need the certificate of attendance, do we need to request that or will it be automatically sent?
You're going to request that as you fill out the Google survey. That's a requirement for either one. There is a question in there if you're looking for a certificate, and it will ask you to choose which one. Or there's an option that I don't need a certificate, but that is part of the Google survey that you will be filling out. And please note that the email address and the name that you put in that Google survey, that's going to be what's used on your certificate, and the email is going to be where that certificate's going to go, going to be emailed to you at.
Okay, thank you. All right, Iman, I think that's how we pronounce. Now to convince our elderly folks to stop using home phones and use cell phones instead. Well, unfortunately, cell phones also get those scam calls. I get quite a few on my cell phone, but I may have to look at trying to block those unknown numbers. All right. I think that's all the questions we have. How to get rid of apps after a free trial when none of the directions work. Ooh. I would say check with your phone provider on that, because you should be able to uninstall those apps if you don't want them on your phone, but check with your provider.
Once again, Jessica, if you'll send me the dates and the titles of the training, I'll be happy to look into that for you. All of, like, again, everything prior to February has been sent out. So if you're having a problem, please email me. I put my email in the chat and I'll be happy to check into that for you.
All right. And your email address is also in the chat.
Yes, I just put it in the chat. And just so you know, the follow-up email that's sent out Thursday, that's going to come from my email as well. So
all right. All right. We have someone who's interested in volunteering. Wonderful.
All right.
Feel free to email Felicia.
And her email is on the slides.
Let me go back. There it is. Her email is on that slide. Email her if you are in the North Central Texas area. If not, she will be able to direct you to your local AAA. That's all we have, Marty.
Great. Thank you so very much. Melinda, Felicia, Veronica, thank you very, very much. Thank you all for joining us today. And once again, as Melinda said, we will be doing this again next Monday in the afternoon as opposed to this afternoon, number one, and look out for the follow-up email that will be sent out to you again on Thursday of this week. Thank you all for joining us, and you all have a wonderful day.
Bye.
You too, Marty. Thank you.
Bye. Thank you.
Bye-bye.
Bye-bye.